This conference will now be recorded.
Good afternoon, everyone. This is Melissa Morin, Whatcom County Health Department Public Information Officer. Thanks for joining us for our media briefing here on, oh gosh, it is Wednesday, February 17th. Just a reminder as we get started to go ahead and mute yourself for the time being. And we have both Erica Lautenbach, Whatcom County Health Department Director, and Cindy Hollinsworth, Communicable Disease Manager, here to speak with us today. And once we've heard from them, we will open it up for questions from members of the media after that. Just give my other usual reminder, which is that we do record these and make them available on Whatcom County Government's YouTube channel and on our media page at whatcomcounty.us/COVID. And then one other quick reminder, we did send out a media advisory earlier today to let folks know that we are transitioning away from the email address for media inquiries that we've been using thus far, and asking folks who want to reach us for either Whatcom Unified Command or Whatcom County Health Department questions. You can reach the public information officers at health-pio@co.whatcom.wa.us. And with that, I will turn it over to Erica.
Thanks, Melissa. Hi, everyone. Thanks for joining. We just have a few updates, and I'll provide a couple, and then Cindy Hollinsworth, our Communicable Disease Manager, will give you some updates about vaccine, but primarily we're here and available to answer questions you have. So continuing with good news on trends in case rates, we continue to see a stabilizing and slow decrease in the rates in Whatcom County, which is very encouraging for us as we're entering the spring and as we're moving into phase 2 as a region and hoping to be able to maintain that status. So I'm glad to see those rates continue to be lower than they had been even a month ago, and headed in the right direction. And second, I want to share, and we talked about this briefly at the last media briefing, I believe, but the Whatcom County Health Department piloted a mobile vaccine program last week and went to 5 adult family homes, vaccinated 26 staff and residents, and piloted both the systems and the operations and the excuse me, and the PrepMod software, which is, if anyone of you have had a test at our site, it's sort of the equivalent of the Test Directly testing software, but for vaccines. So it allows folks to register in advance and have a scheduled appointment. And we'll be using that moving forward, and it was a good chance for us to kind of test our systems. Our focus is really on vulnerable populations and those where we really want to start to see some reduction in health disparities and continued focus on equity. And so that really encapsulates those folks that are vulnerable populations, may have difficulty accessing vaccine or would not be able to be vaccinated otherwise. So we now have a good system in place, and we will be ready to supplement and support all of the other providers when the time comes and supply is available. So with that, I will turn it over to Cindy.
Good afternoon. So I have some updates about vaccines. It's probably not too different than what you might already know from other media sources, but we know that first and second doses of COVID vaccine have gotten out of balance in Washington, and that's because of the, when the governor gave the directive to use 95% of vaccines within a week, there was some application of that where second doses were used for first doses. And so we're just in a rebalancing step in this week. And because of that, the State Department of Health has prioritized second doses this week. First dose appointments are very limited, and also want you to be aware that because Monday was a holiday, that shipments did not begin arriving until Tuesday this week. So for Whatcom County specifically, that means that we have 0 first doses and 2,400 second doses for this week here in the county. We know that the chain pharmacies in Whatcom County also received 1,300 doses of COVID vaccine last week from the federal retail pharmacy program. And this is separate from our weekly allocation from DOH. We are learning more about how we will receive regular updates on the distribution from this program. So that's the information that we have right now. So I know it can be confusing when we say there was no first doses, but that was through the DOH program, and then this federal program distributes directly to pharmacies. So generally, I would say vaccination clinics at providers and pharmacies are going well. The systems have been piloted. Our partners are ready to manage large amounts of vaccine. We're really fortunate here in our county to have so many entities stepping up and becoming approved vaccine providers. We now have 37 approved providers in Whatcom County. So this is really good news for us as a county that we have so many access points. And then we also, let's see, Erica talked to you about the mobile vaccination clinic, which was a great pilot for us. The other thing that was great about that software is that we could send a link to the adult family homes ahead of time. They could help their residents and staff register and complete all of the paperwork ahead of time. So it's going to be a really good model for connecting with people who might need assistance registering as well. I think there's a lot of opportunity there. Another good, as part of that mobile vaccination clinic, we ordered 100 vaccines, and so we did transfer the rest of the vaccines that we did not give to the adult family homes. We did transfer that out to the Point Roberts last Friday, so that'll be an opportunity for them as well to do their first vaccine clinics and get those up and running there in their community. We are continuing to work with partners on plans for a large-scale community vaccination clinic, and we'll be ready to make announcements about that within the next week or so. More details to come.
All right, thanks, Cindy.
And Melissa and Cindy, I was remiss. I meant to share that on Monday we started the second testing site at the Bellingham Airport. Whatcom Unified Command and the Health Department worked with Northwest Labs to host a second site for our no barrier access to testing. The scheduling software Test Directly now allows folks to test either at the Linden site or the Bellingham site. And through this partnership and using our health officer standing order, folks can get a test without going to their doctor in both Bellingham and Linden. And so far, so good. We're really encouraged by what we're seeing in terms of numbers and turnout. And it is certainly translating to fewer people going up to Linden. So we know that that was a need that we're now able to better meet for our community. So just a little information on that.
And I just think it was so impressive that Northwest Labs stood up their first day in the snowstorm. So I just want to give an extra kudos for that.
Just a really great partner. Yeah.
So we take any questions at this time. Melissa's got some directions there in the chat box.
Yes, feel free, members of the media, if you have questions you'd like to ask of either Cindy or Erica, type your name and affiliation into the chat, and I will call on folks in the order received. And it looks like our first question is from Key with the Herald. Key, go ahead.
Thank you for making time for us today. This is a question for either Cindy or Erica. Cindy, you had talked about the, I think in the next week or so, you expected to have some additional details about a mass vaccination clinic. Does that mean that you expect that we are going to be getting more vaccine doses? Because that has been iffy at various times. Thank you.
Yeah, that's a great point of clarification, Key. We are planning for when there is adequate supply and that we're seeing our 37 partners are getting vaccine when they're ordering it. And when there's more people eligible and more vaccine available, then we will stand up this large scale clinic that is also a multi-partner effort. So there's going to be more vaccine coming. It's just about when. So we are doing all the work behind the scenes right now to make sure we're just ready to stand up with very short notice when there is vaccine.
Our next question is from Joe Tehan with KGMI. Joe, go ahead.
Thanks very much. We've gotten a couple of calls from people who are as they describe themselves, are eligible. They're elderly, eligible for a vaccine, but they don't know how to find out if they are or how they can get in line, and they don't have internet access. And I don't know what to tell them because you've said before, don't call your provider. I'm wondering what kind of instruction we should give those folks.
Yeah, that is a great clarification. We do know that there's and I don't have it readily available, but my understanding is there's a State Department of Health call line where people can call to get help scheduling appointments. So it's not a local model, but they have access to the same information. And we have been hearing about some innovative pilots, depending on how people are connected, that they might actually be getting a call from a provider or a pharmacy to schedule an appointment, and so they don't have to reach out themselves. So I don't have any more details than that I can release, but I think it is slow and frustrating, and I understand that.
Our next question is from Sue Romero with Como Radio. Sue's asking, what are your latest COVID case counts and the number of people vaccinated compared to a month ago?
I can share, I was just looking at our risk assessment dashboard, and I can share that just in the last, 10 days, our case rate has come down over 100 per 100,000. So we're really seeing, and that's unofficial at this point, as those numbers are reconciled, but we're really seeing quite a noticeable and significant decline in the case rates. And Cindy runs our morning huddles every day when we go over how many cases we're seeing, and the numbers are strikingly lower than they have been in the past. And Cindy, if you want to comment on that. And then in terms of the number of people vaccinated to a month ago, do you have that information, Cindy?
I don't have that. I think the best I could do would be to look at the website and see the total number vaccinated to date, which is like around 17,000. And I'm not sure if the website takes it out by week.
This is Melissa. I can share some details in the chat here where the information is. Both the state's data dashboard and the Whatcom County data dashboard do show the number of vaccinations given by date. So I'll type some instructions into the chat of how to access that information.
Thank you, Melissa.
Our next question is from David Rosbach with the Bellingham Herald. David, go ahead.
Hi, Erica. Thank you so much for taking the time to talk to us. During the last online briefing, you expressed some that you were waiting for some answers from the state about how they are distributing vaccine to different counties and different regions of the state. And obviously, this week's a little bit of an aberration as the entire state tries to catch up on first and second doses. But have you gotten any answers to those sorts of questions so you can start planning longer range for what vaccination here in Whatcom County will look like as we progress?
Yes and no. We haven't received all of the answers in terms of the transparency around how many doses which county is receiving and why. We do know in conversations with the State Department of Health that they're really trying to right size how far along counties are. So for example, I heard on a call yesterday that there were a number of small counties that are poised to move to the next phase that haven't received first dose vaccine in several weeks, as the state repurposes those doses to counties that need more doses in order to be able to move to our next phase of those that are vaccine eligible. So we are still actively working with the state on understanding what the criteria are and how those decisions are being made. But I feel like we're having good conversations, and I know Cindy's involved with the vaccine team at a state level. If you have anything else to add, Cindy.
I don't think specific detail. I know there's plans to move to a 2-week allocation model sometime in the future. So that will give us a little bit more stability in planning, a lot more. And I think there's just a lot more to come here in the next week or so around systems and partnership and looking at the data and making decisions.
Thanks so much for that. Our next question is from Adela Cruz with the Western Front. Adela, go ahead and ask your question.
Hi, I was just curious how the metric system evaluation is going to work in terms of how it's going to be measured to stay in phase 2. Is it the same evaluation? Is there slightly different changes? Just curious about that.
We don't know what the next phase will look like or if there will be any changes in the associated metrics for phase 3. So that's still an unknown at this point.
Thanks, Erica. Our next question is from Robert Mittendorf with the Bellingham Herald. Robert, go ahead.
Hi, Melissa. Thanks very much. So yeah, with the recent drop in case counts, obviously there was no Super Bowl surge like it had been feared. But what do you attribute the sudden drop? I mean, the cold and flu season isn't over. You'd think that, was there a marked change in people's behavior, or?
Well, yeah, I was going to jump in and say we do know that the surge in January and through the holidays was likely related to large family gatherings through the holiday season. So as those tapered off and people got back to their kind of regular lifestyle, less gathering, I think that's part of the result of the cases dropping. I don't know, Erica, if you had anything else in there.
No, we are encouraged to see that there doesn't appear to be a bump or an increase associated with Super Bowl. And I have joked with a couple of coworkers that we really hope people had more subdued President's Day celebrations this year as well. No, but it is encouraging. It is encouraging to see the numbers coming down.
Great, thank you.
Next question is from Key Relia with the Bellingham Herald. Key, go ahead.
Thank you. Cindy, I think it was you who mentioned that the chain pharmacies here that are part of the federal retail vaccine program received about 1,300 doses of vaccine, or 1,300 doses last week. Am I saying that correctly? My question is there somewhere where we can put that information? Because I know that people are just all over the place trying to figure out who has what when. And then if you're posting, and related to that, if you're posting information for how many doses through DOH this week, does the federal retail pharmacy program follow the same timeline? Okay. Okay. Anyway, whatever you can answer would be great. Thank you.
Yeah, I think that's we wish. And so we are that's the report we got yesterday is the first report we've had from that federal program. So we're just going to have to wait and see what it looks like, how regularly we get that. Are we always going to be a week behind? So the report we got was for vaccines distributed that way last week. Now the pharmacies, they could also be getting vaccine through the DOH program. So I would say it's whether it comes through the federal program or the state program, it's still going to be accessed through a vaccine appointment the same way. I mean, so for the user, on the person trying to find the appointment in, there's not a difference there. So if that's helpful. And I don't know if I answered all of your question.
You did, thank you.
Okay.
Next question is from Joe Tehan with KGMI. Joe, go ahead.
Thanks, Melissa. Yeah, and I was going to ask about that federal program too, but I got my question answered via Key there. But also, as far as the local providers that are part of the state and the county vaccine distribution program, have they all gotten at least a share of the vaccines that we've received so far? And I'm wondering how it's allocated per provider.
Yeah, I think that's one of the big questions that we're seeking to find some more information about. I know that there is a big shift even in this week for more considerations around equity for vulnerable and underserved populations and trying to decide where the vaccine goes to, which those decisions are made at the State Department of Health level. So of those 37 providers, some smaller practices who don't necessarily have a large population of patients over 65 or 1A workers in their patient panel, they're choosing not to order a vaccine at this time and to let the larger clinics who have the ability who really need to stand up and get their operations going for them to have more opportunity to receive vaccines. So it's still a little tricky to figure out how that allocation is being made and the decisions made. And of course, this week we couldn't tell anything because nobody got any first doses. So I think we're going to find out a lot more when we see the allocation for next week, see what kind of shifting we're getting. We do.
If I may, oh, I'm sorry, go ahead.
Go ahead.
If I may add to, one of the roles of the health department is really that coordination role. We have a weekly meeting that is open to all enrolled providers in our county where we can talk about some of these issues, who plans to order, how much, what their priorities for the week are, how we can work together as a system rather than as 37 individual entities all competing for a very scarce resource. So that is something that the health department is leading, and we really feel like there's a lot of interest in having a coordinated response in this way from our providers.
Thanks for that. We'll do a last call for questions here, and I will just add in response to finding out which providers do offer appointments, whether they're in the federal retail pharmacy partnership program or whether they're receiving doses through the DOH program. All providers are listed on the vaccine providers list, and that can be found at covidvaccinewa.org. So regardless of which program, all providers who are offering appointments and wish to be listed can be found on that page. And it looks like we have another question from Key with the Herald. Key, go ahead.
Thank you. This is a question for Erica. Regarding the mobile unit, did you say it was that you were able to provide first doses? It was for 26 staff and residents at 5 adult family homes? Is that correct?
Yes, okay. That's correct. Yep, that's correct.
And so what you didn't use, you provided to Point Roberts for their vaccine clinic. And the number that you had for the mobile clinic that you had ordered for the mobile clinic, was that 100 doses?
Yes, we can only order in increments of 100. So we ordered the bare minimum.
Okay, great. Thank you. I just wanted to double check.
Yeah, yep.
All right. It looks like that is the end of our questions, so we'll go ahead and conclude the media briefing now. Again, you can find this recording in a couple of hours up on the Whatcom County Government YouTube channel. Thanks for joining us, everyone.
Thank you.